pathway is stimulating a particular group of muscle to carry out the movement, whereas the indirect is inhibiting all the other movement, so that you don't, when you're moving, you are not whole body is moving, you're just doing it properly. Your the specific group of muscle which is needed to carry out, that will be stimulated, rest will be inhibited by this indirect pathway. So that is the role of the. Okay, so now I want you to do an experiment. Okay, so all of you, if you can you do like this first? Yeah. Okay. Now do like this. Okay. Now you see, can you do this two movement together? You won't be able to do it normally. Okay, you can still do it. So for example, move your this. Quite a few of you can be able to do it clockwise. So this is clockwise, and this is anti-clockwise. Okay, and now these do it together. Okay, so with practice you can do it, but without practice, because basal ganglion is normally stopping the alternative movement, so they only allow a certain group of movement and don't allow the other group of movement. So what happened? So what is operational learning? And that's very important to understand. So whenever cortex or even subcortical structure send information to basal ganglion, you do an action. Okay. And if you see the effect is positive, that's when dopamine is released and you get into habit. Okay. So if you know that reaching it, this is the most efficient, next time you will do it. Next time, every time you will do it. And that's because that is the most efficient. But whereas if I try to reach it this way, that is not efficient, you realize, so immediately the dopamine release will go off. It will not be there. So you won't carry out that movement. That movement won't be learned. Okay, so the learning process takes place in this striatum. So this part. So if a program is rewarding, that program will be stored, and that is called the procedural memory. Okay, so that the program will be stored. So next time you need the same, that will be activated. Whereas if a movement is not appropriate, it's not rewarding, dopamine will not allow the changes in the striatum to happen. And thereby you won't remember that movement. So that's how we learn. Okay, so that's the
Can you see then you talk about LTP, long-term potentiation?
No, this is long-term potentiation, obviously in striatum, and it is a motor learning. It's not memory for semantic or episodic. This is a what is that called? Procedural memory.
Things like guitar playing or
Exactly. So whichever, when you are learning guitar or piano, you do it step by step. So one step, if it is efficient, that's when you carry on doing that. So that's the operational learning. Now for example, you have learned the program A1, but to carry out the whole, you might have to add this few of these operational learning, and that is called the process of chunking. Okay, so that's the next process. So the typical example of chunking is what you master. So after when you initially drive, for example, you are driving, you are looking at the mirror, you are changing the brake, it all appears too much. But after a while, because of the chunking, basal ganglion has compiled all this programming. You can do it without any cognitive thinking, because that's being learned. So initially you have to think to do it, whereas after a while you are not able to, you don't require to think, because so if the operational learning you have learned A1 program, A2 program, A3 program, so in chunking what basal ganglion does, it will add all these program so that you can carry out a motor activity smoothly. Okay, so that's the advantage of the, so it is very fast and efficient, and you don't have to use the cognitive process. In case of operational learning, you get a reward. Okay, but here once that is chunked, you don't need any reward. Okay, irrespective of reward, you will carry on. But when it comes to, if you for example, if you are doing something and if you have to stop that for in chunk movement, you cannot do that. It's very inflexible. Whereas operational learning, when you are learning it, you can learn different way, whichever is the most efficient. So it is very flexible. So that's the again the function of the basal ganglion. When you learn a function, you chunk. So it makes it faster, efficient, but it is rigid. Okay. And it is outcome independent. So for example, we will come to that. Apart from the motor learning, basal ganglion is also important for other learning. When it comes to drug use specifically, when initially they take the drug, there is a high, and because they get the reward, they are taking it. But after a while, once it's chunked, irrespective of any gain, that become like a automatic habit. Okay, so they take the drug because of the habit, and that's a typical example of chunking. And that's again the function of the basal ganglia. Now, what is the role of the dopamine? So dopamine is secreted from, as you know, substantia nigra. So what does dopamine do? Dopamine, one, is the motor oil. So as we have said, like it without the oil you cannot run a car. So dopamine is like that. So that's why if you don't have dopamine, the typical example is Parkinson's. They cannot move at all. Their movement is very slow. And also another important thing, degree of movement. Okay, so if you have got enough dopamine, then you move normally like us. If you have got less dopamine or no dopamine, you become Parkinson's, where you're not able to move at all. Whereas if you have more dopamine, in what condition you can get more dopamine? Amphetamine, okay, which can give you more dopamine. There, in amphetamine toxicity, for example, they cannot sit. They are very hyperactive. So the amphetamine abuse is used to be very common among the medical students because they have to learn a lot. So they used to use that. I don't know how far it is effective, but that's one of the where they get agitated, hyperactive, because there's lots of dopamine in the system, which is stimulating the basal ganglia. Now we have just told about the motor pathway. So the basic structure is same. It has to come from the cortex or the subcortical. It will come to striatum. It will come to pallidum, and then it will go to the thalamus if it is coming from the cortex. And if it is in the subcortical, it's slightly different. So we have got loop for motor and non-motor function. So what are the motor functions? So movement of the limbs. So that's the motor function from the frontal lobe. And we have got eye movement as well. So that is again controlled through the basal ganglia. You don't need to learn exactly what are the pathway, but just remember this loop has to go through the basal ganglion towards. So if somebody has got a basal ganglion problem, they will have problem in moving their eyes as well. Okay, so like
a
gaze movement. So they can have gaze movement. Okay, abnormality. Then it is not only responsible for motor function, it has got non-motor. So what are the non-motor? For example, it has got prefrontal loop. Oh, you can have a seat. It will take 5 minutes. Okay, so the non-motor loop, for example, you can get when you are taking a decision. When you have to take a decision, there might be 3 or 4 options, but you choose one. Okay, so that's the function of the basal ganglion. Basal ganglion has to say yes to a program for you to take that decision. Again, for a particular mindset, for example, your emotion, it is determined by basal ganglion. Basal ganglion choose which is the most appropriate depending on the other factors, and that is again the function of the basal ganglion. So lot of patients might have got problem with sometime with emotion and things like that, which we don't always, that can happen with the basal ganglion problem. Okay, they might find it difficult to take decision. Their mood might change. It is very, very common to have this neuropsychiatric problem with basal ganglion. That's because it has to go through all these loops. So as you see, basal ganglion is sitting in the middle. It receives from the frontal lobe, which is responsible in the medial part for the emotion. The anterior part is for the decision making, higher executive function. It also gets the perceptual loop. So what you see, so there are so many things to chew. You get lots of information. Not all information come to your attention. Again, that's determined by the basal ganglion as well. You get information from the occipital lobe. Your eyes are receiving lots of information, but you are attentive to only certain things, and that's determined by the basal ganglion. So basal ganglion has got a very important role in attention as well. So apart from the basal ganglion, there is cerebellum as well, which is very, very important in doing a motor activity. In contrast to basal ganglion, cerebellum receive the raw data. They receive the sensory information from the periphery. Okay, whereas basal ganglion receive more higher information either from the cortex or from the subcortical structure. So what is the basal ganglion always work to achieve a goal, whereas cerebellum, it's only facilitate movement. It doesn't matter what your goal is, that's left with basal ganglion, but it only help you to move, or they will not choose what movement it is, whereas basal ganglion will say, oh, this movement is not correct, we won't do it. Whereas cerebellum will do all the movement and basal ganglion will choose and allow only the movement which is important, which is rewarding. Okay. So that's the end. It's very, I know it's very complicated, but I always find it quite intriguing. And you see basal ganglion, some patient has got dense weakness, other patient has got a big basal ganglion involvement, nothing is there. Nothing means physically nothing is there. Obviously, when they go to SNEED, the therapist will find out, and then they will tell you, oh, they have got attention problem, they have got this problem, and then you can understand, and they have got severely depressed. Okay, so these are all the functions of the basal ganglion. Sometimes we overlook, and that's why I think nothing has happened to the patient. It cannot be nothing has happened to the patient. We don't look for it. Okay, thank you.
Thank you.